In this video, we will review prescription errors and omissions, or E's and O's, a part of the written portion of the New York State Board exam, Part 3. This video is meant to help you prepare for Part 3 of the New York State Board exam. It is created with the best available information produced by the New York State Board of Pharmacy. Keep in mind there is no guarantee that the examination directions will be exactly the same as what is seen in this video. Nor is there a guarantee that the examples in this video represent the level of difficulty that will be on the actual examination. Make sure you read the directions carefully when you take your examination to ensure that you are answering each question appropriately. Part 3 of the New York State Licensure exam is made up of two parts: the compounding and IV, which is given on one day, and the written portion, which is given on a separate day. The written portion is comprised of three different components: errors and omissions, which is worth 20 points of the total 100 points of the exam, look-alike, sound-alike, which is worth 8 points, and patient profiles, which are worth 12 points. In this video, we will concentrate on the errors and omission portion of the exam. The errors and omission portion of the exam is meant to assess if you can find an error or an omission in the prescription filling process. Prescription errors are mistakes in the filling or labeling process. Omissions are the absence of required information on the prescription or label. Make sure you know what is required by law to be on a prescription or on a prescription label. This is a sample of what the directions might look like on the exam. On the following pages, you will find the errors and omission pages. For these exercises, please assume that all addresses, DEA numbers, and RX numbers are correct, as well as that all scripts are written on the appropriate paperwork for the appropriate setting. For example, community prescriptions are written on a valid New York State prescription blank. Also, AKA and JOI are the pharmacist dispensing the medication, and MCB is the pharmacy intern. If the prescription can be dispensed as is, choose yes when asked if it can be dispensed as is, or no if it cannot be. If it cannot be dispensed as is, explain why in 10 words or less what the issue is with it. Remember, the dispensing of this prescription is not based upon company policies or what you would personally require, but based upon what is legally required and acceptable. For example, drug name and strength are not required to be on a prescription label. On the errors and omissions portion of the exam, you are given a picture of a prescription, a label of how that prescription was filled, and a picture of what medication was dispensed. You should proceed through the process of looking at the prescription first and verify that everything is correct and that there are no omissions. Once you have identified that there are no problems with the prescription, you then look at the label. Check the label against the prescription, and any problems you find would be a problem with the labeling process. Once you have checked your label and made sure that that is correct, then look at what medication is dispensed and check that against the label. If there's a problem, then there's a problem with the medication dispensed. Make sure that you're comfortable with the process of checking for prescription errors and omissions. This will guarantee that you can systematically find problems. When looking at a prescription, verify that it is complete, legal, and correct. Check to make sure that the patient name is listed on the prescription. Also make sure that the date written is correct. Remember that this is important when you're looking at prescriptions for controlled substances. Next, make sure that the provider's signature is on the prescription, and make sure that it's signed by the right person who is listed on the prescription. Make note as to whether the doctor is a physician, a physician's assistant, or a nurse practitioner, or a doctor of veterinary medicine. This may come into play later with the medication dispensed. Look at the drug name and make sure that the prescription is actually within the prescriber's scope of practice. Next, check the drug strength. Is it a strength that exists? Is it correct for the indication if an indication is provided? Also look at the dosage form and make sure that the dosage form is something that does exist. Next, check your directions. Are they correct? Are they appropriate for the patient age? Are they appropriate for the indication if one is listed? Check the quantity and make sure that it is something that is allowed by law, especially if the prescription is a controlled substance. Once you've looked at your prescription, now look at your label. The prescription is considered to be correct unless you found a problem, and any discrepancies from this point mean that the label is incorrect. Check the patient name on the label with the name on the prescription. Check the date filled, the patient address, the drug name, or the appropriate generic if there was no DAW on the prescription. Check the strength, the dosage form, the directions, and make sure that a maximum daily dose is listed if necessary. Check the quantity, check the provider's name, and check the refills. Make sure these things are correct with respect to the prescription. Finally, look at the medication dispensed. If you have not found a problem, the label is considered correct, and any problems mean that the medication being dispensed is incorrect. Check the drug name, the dosage form, and the strength. You will receive 10 prescription errors and omissions to evaluate. Each error and omission is worth 2 points for a total of 20 points. There is no partial credit. There is a maximum of 1 error per prescription or none. Explain any errors you find in 10 words or less. To prepare for this portion of the exam, make sure you have a checking process to ensure a thorough examination between prescription, labeling, and dispensing. Be familiar with the top 200 drug list, your brand and generic names, the dosages of medications, and what each medication is used for. The pharmacist's letter at www.pharmacistsletter.com is a very good place to look for information on medications that have special prescribing and dispensing requirements. It's also a good place to look for new drugs that have been released. The New York State Board Exam Part 3 is usually recent up to the last 3 months. Make sure you are familiar with your controlled substance drug laws as well and diagnosis codes for prescriptions. For more information on how to prepare for Part 3 of the New York State Board Exam, please refer to the other videos on this website.